What happens at age 80? Well, first of all, your body starts to shut down. Your organs aren't as efficient at doing their jobs as they used to be, and everything starts to go downhill from there. And even though this is a fact of life that we all have to accept eventually, it doesn't make it any less painful. In fact, there are some things that only become really apparent when you reach the age of 80. So today we were going to explore 6 painful realities after age 80. These are some things that you should definitely be aware of if you are reapproaching this milestone birthday or caring for an elderly loved one. Be sure to stick around until the end, because the last one is often overlooked, but can really make a difference in the quality of life for many seniors. Starting with number 1, hearing loss becomes more pronounced. As we get older, our hearing starts to deteriorate, and by the time we reach 80, most people will experience significant hearing loss. This can lead to problems with communication, making it difficult to follow conversations or participate in group settings. It can also cause social withdrawal and isolation, because it can be exhausting and frustrating to constantly ask people to repeat themselves. If you're noticing that you or someone you care about is struggling to hear, it's important to seek professional help. A hearing aid or other assistive device may be able to help, but do not wait too long to seek help, as untreated hearing loss can lead to further cognitive decline and physical health issues down the road. Moving on to No. 2. Vision problems increase. Just like our hearing, our vision also starts to decline as we age. By age 80, most people will need reading glasses or have trouble seeing objects that are close up. Cataracts and macular degeneration are also common, which can lead to blindness if left untreated. In addition to regular eye exams, there are several things you can do to help prevent vision problems as you get older. Eating a healthy diet full of fruits and vegetables that are high in antioxidants can help protect against age-related macular degeneration. Regular exercise can help keep your blood pressure under control, which is important for overall eye health. And avoiding smoking and excessive alcohol consumption can also help reduce your risk of developing cataracts or other vision problems down the line. Next up at No. 3. The risk of falls increases. As we get older, our risk of falling also increases. This is due to a number of factors, including decreased muscle mass and strength, poor balance and coordination, and decreased reaction time. Falls are dangerous for older adults because they can lead to serious injuries, such as broken bones or head trauma. They can also cause fear and anxiety, which can lead to social withdrawal and decreased activity levels. There are several things you can do to reduce your risk of falling as you age. First, make sure your home is safe by removing tripping hazards and installing grab bars in the bathroom. You should also try to stay active and do exercises that improve your balance and coordination. Finally, make sure you have a support system in place so that you're not afraid to ask for help if you do fall. Moving on to No. 4. Loneliness and isolation become more common. Unfortunately, as we get older, loneliness and isolation become more common. This is due to a number of factors, including the loss of friends and family members, retirement, and decreased mobility. Social isolation has been linked to a number of negative health outcomes, including dementia, depression, and even premature death. If you're feeling lonely or isolated, there are a number of things you can do to help combat these feelings. First, stay in touch with friends and family as much as possible. You can also join a senior center or other community group to meet new people and stay active. Finally, consider volunteering your time to help others. This is a great way to feel connected to your community and make a difference in the lives of those around you. Next up, at No. 5. Mobility becomes more limited. As we age, our mobility will eventually start to decline. This is due to a variety of factors, including decreased muscle mass and strength, joint pain and stiffness, and balance problems. Mobility issues can make it difficult to perform everyday tasks, such as getting in and out of a chair or walking up a flight of stairs. They can also lead to social isolation and decreased quality of life. However, there are several things you can do to help maintain your mobility as you age. First, stay active and do exercises that improve your strength, balance, and flexibility. You should also make sure your home is safe and accessible. Finally, consider using mobility aids, such as a walker or a cane if needed. With a little planning and effort, you can help maintain your mobility and independence as you age. And finally, at No. 6, the need for medical care increases. As we get older, the amount of medical care we need also tends to increase. This is due to a number of factors, including the fact that older adults are more likely to have chronic conditions such as heart disease, diabetes, and arthritis. They are also more likely to have multiple medications and may need help managing their medications and side effects. In addition, older adults may have difficulty accessing transportation to get to doctor's appointments or may not have the financial resources to pay for necessary medical care. To address these challenges, it's important to have a primary care physician who is knowledgeable about the unique needs of older adults. This doctor can help coordinate care and make sure that the patient is receiving the necessary medical, social, and emotional support. In addition, there are a number of community resources available to help older adults get the medical care they need. Senior centers. Churches and other community organizations often offer transportation to doctor's appointments or can help with the cost of medical care. By taking these steps, older adults can ensure that they receive the medical care they need to stay healthy and independent as they age. Overall, getting older isn't always easy, but by being aware of the challenges that lie ahead, you can take steps to mitigate them and make the journey a little smoother. From maintaining your physical health to staying socially connected, there are things you can do to ensure that you age gracefully and enjoy your golden years. We hope this video has been helpful in providing insight into what lies ahead so that you can prepare accordingly. If you enjoyed this content, please remember to like and share for more informative videos like this one. Thank you for watching, and see you next time.